Hi, everyone. I'm re recording my course to include parents of teenagers and young adults. So, hope you enjoy this revised model. I'm here to talk about attunement and connection to teens and young adults, a unique approach. And I'm calling this version Seen and Heard. So, it speaks more to their experience. This is my own family of now young adults. That went fast. And from this, we're going to learn what's typical teen behavior, what's a red flag, when to worry and when to relax, how to talk so your teen actually listens, how stress, sleep, and social media affect your child, and when to reach out for extra support. So, we'll jump right into module 1. I've been doing this work for 30 years, so just sharing a lot of personal anecdotes and deep learning. I came up with the word attunement for this because I like the definition, a social contemplation. It's a way of living, an art form. It's how we bring our deeper embodied and contemplative life into daily life and all the small moments that compose our entire experience. Almost like teaching young people how to be spontaneous again after everything's shut down. So let's just jump into a case. Sasha comes in slouched with her hoodie up. She shrugs at every question. Silence fills the room. What do you do? Instead of rushing in with more questions, you sit back and mirror her body language and say, feels like you'd rather not be here right now. And that's okay. We don't have to talk until you're ready. Attunement means pacing the client's rhythm, even if it feels slow or uncomfortable for you, the therapist. And then there's the case of Emma in grad school, talks about panic before presentations. She says, I feel like a kid who can't do anything right. So, what do you, the therapist, do or the parent? You normalize her aggression by linking her to the reality of developmental stress. It makes sense that you're bringing in old fears. Part of being 22 is still finding your footing as a confident adult. You're not alone. So we frame anxiety as part of normal developmental transition, which is so true for this age group. For some reason, they think that they have to be perfect. So in the brain, we have the amygdala over here, which regulates um, emotion, and the hippocampus over here, which also mediates that response. So when you're in a trauma reaction, these all go offline. So yoga and exercise can reverse the stress on the polyvagal nerve, which comes down the back. And it enhances your perception of sensations in your body. So we want to push against whatever anxiety you may have inherited and teach ourselves ways of being more at ease. And that means the therapist is going to co-regulate with you. The therapist is not your friend, but can invite a friendly, warm, comfortable feeling. Remember, it's not about you, the parent, or the therapist. You are just simply a conduit transferring information. Therapists can talk, but not monopolize the session. I find over the years that young people want you to talk, and I'm happy to do that. The role of chemistry, people try out cars more than therapists. It always amazes me. And you cannot get attached to the outcome. You can't, and you also, like some people are not going to make progress, and that's just how it is. Um, yeah, you get lost in the content of she said, he said, this happened, that happened, what happened, when did it happen, then you're no longer listening to the process. And at the end of someone's story, you can say, I'm proud of you. I think people don't hear this enough. Proud of you for just trying to be with it, trying to be here. The role of the parent is to stay calm and regulated. Listen more than you talk. Set clear and consistent boundaries. Offer support, not rescue. Show empathy and connection. Pick your battles and encourage healthy outlets. Also, role of the parent, don't overreact, don't shame or compare, don't dismiss their feelings, and don't be inconsistent. If there's a divorce situation, you're supposed to show up on Tuesday night. By all means, please show up on Tuesday night at the designated time. It's so important. You do not want to be thought of as the parent who flakes out every week. And going back to don't shame, I had a woman in my office with her young adult freshman in college, and she pointed to her daughter in my office and said, you could be a 10, but you're really just a 5. And the look on her face was just devastating. How can a parent say that? Don't make it about control. Don't take it personally. Mood swings and pushback and withdrawal are all part of development. It's rarely ever a reflection of your worth as a parent. Don't avoid the hard conversations. Ignoring issues doesn't make them go away. Approach with openness and curiosity, not fear or judgment. You were a teenager once too. What to do when you don't know what to do? Lower stress, lessen depression, decrease anxiety, alleviate negative mood, quiet the inner critic. So what? Fake it till you make it. Build resilience, strengthen self appreciation, increase sense of gratitude, tolerate feelings, learn from mistakes, take a break, and get outside. That's my dog. What about when stress hits extra hard? Scan your body, see where it's bothering you. Listen to music, meditate, rest in the present moment. Remember your feet are planted on the ground. Soothing touch, core values, a pledge to yourself that you're going to do what you intended to do. Compassionate friend, strength, wisdom, and compassion within yourself. And journal, write it down, get it out of your brain and onto the paper. Group therapy is a wonderful way to reduce stress. And I've been running groups for 30 years. And it really strengthens the client's confidence. You can see it in the work. Normalizing and universalizing in groups is such a wonderful gift. Some people are literally sitting with their feelings thinking, I am all alone in this world. So it gives a safe space, no judgment, boredom, loneliness, belonging, giving advice, purpose, and meaning. People light up in the group when they share with others, and the other one says, yes, I know. Nothing more powerful. What to know? Strategies for building rapport and resiliency with teenagers. One is laughter, effective communication, not text fighting, knowing when to seek help and engage the school. So many parents tell me, I don't want to engage with the school. They're going to stigmatize my child. And I mean, to some extent, if you get pulled out of the classroom, yes, ma- it's stigmatizing, but it also may give you free extra help. Signs of indicating the need for involving family or professionals. Yes, you have to tell them how it makes you feel. Just some kids just need the smallest intervention, like someone to help them organize their assignments. Um, and tell yourself to use common sense. If you hear something in a session from a teen or young adult that makes you feel panicky, pay attention. Does the therapist have to be just like me? So many people want like a middle-aged Jewish female therapist like me. Okay, it helps. It helps our shared cultural understanding. I get it. But doesn't have to be. Just like a doctor can be nice and thoughtful and wonderful, or can be completely out of touch, no matter what they look like. Am I making progress? You can ask. There should be ways to measure that. But if there's trauma, the therapy will take some time. Don't rush it. And then other young people and teenagers, right away, they want to know, what is my diagnosis? As Pema Chodron said, she's a Buddhist monk. Nothing ever goes away until it teaches us what we need to know. So I like to look at the whole picture, get to know the person, then talk to their parents if needed. But I like to keep the teenager in the driver's seat for as long as possible. Take a holistic view. We therapists don't, the diagnosis is helpful and it guides us, but we don't have to cling to it. There's a spectrum for everything. What I like to do is support life skills. Like for me, I learned lots of cool things in my life, but I never learned a lot of basic things: balancing a checkbook, changing a tire, writing a cover letter, sending a thank you note, signing up on LinkedIn, loan consolidation. Ooh, that's a big stressor. Spell checking a resume, getting a car inspected, dressing for an interview, going to the post office, getting a hobby, proofreading. Please proofread everything. You don't want to be that person who can't get a job because your email's riddled with typos. Come on, take a minute.